Hello, John.
Hello, Oliver.
Today we're going to talk about the GDPR.
Yeah, it's short for something to do with new restrictions on what people can receive and what people can send. For example, now companies and various people that contact me by email, and which I'm very glad to receive, have to send me emails and ask me to affirm that I still record them, because the fact that emails are sent to a person doesn't mean that they want them. So I've had to do that. That's one example. It has affected business because heretofore they could look for customers by sending them information about their products. Now I think they have to look for the permission of those potential customers that they will accept their emails. So it's made too many difficulties for business. On the one hand they're promoting business, and on the other hand they're putting restrictions. So it doesn't make sense. Now whether this dictate of this new restrictions, whether it's come from this government, which is capable of anything, or at the dictates of the EU, we're not clear. But it certainly doesn't help communication, number one, for business, and especially in the hospitals. Now, apparently, they can't communicate with one another the way they could heretofore. Now, the way they communicated heretofore was by fax. Even though we're in the internet age, and the handiest way to send information about patients who are undergoing tests of one kind or another, including blood tests, that it could be sent from one hospital to another by email. But apparently that hasn't happened and doesn't happen. And now the way that they were sending by fax, now apparently that can't happen because of this new GDPR, this new restrictions of what you can send. So you can see that patients are suffering, will suffer, and have suffered from this lack of communication between hospitals.
I think when you look at the scope of the GDPR in hospitals, it's going to be very difficult to implement. You have about probably 15 different areas. I mean, you've got controls and medical records, libraries, you've got security, storage of patient observation charts, disposal of handover lists, use of fax machines, lack of speech privacy, absence of audit trails, consent for research, data retention. There's a whole list of things there to go on.
Well, you see, that's part of the problem. I mean, it's improving communication. It should be the object of any government in support of improving communication. This is an example, for some reason, of restricting information and the kind of restrictions that they have imposed on Irish people, that they cannot express themselves in many ways, bar is politically correct. So this is a kind of a totalitarian approach to what should be straightforward. I mean, hospitals should be encouraged to use the modern methods of communication that's available to them, and not to be kind of encouraging now people that have undergone tests in one hospital for that hospital to send a letter to the hospital where they might have to attend for very specialised treatment. So this kind of is going back to the dark ages in my view. We're in the internet age. Young people now unfortunately are using iPhones and the internet far more than they should. So therefore it doesn't behove hospitals and people and places like that where patients' health is at risk, that they should be able to communicate far more effectively with one another than they are at the present time.
Do you think it's all very over the top?
Well, I think that I don't know what's wrong with the media that are not questioning this restrictions on what you can receive and what you can send. It doesn't encourage business, as far as I know. They're trying to roll out broadband in parts of the country that haven't got it, and to increase communication and the opportunity of doing business. But on the one hand, then they're coming out with this, restricting what you can send and what you can receive. So I don't see any sense to that in a pro-business or a pro communication direction. So I think it's a very negative thing that they've done, and I'm surprised that the media, perhaps they're clueless in these matters, but it's the one that they wouldn't speak up and comment on these matters. I don't expect much from the pro-abortion RTE or that sort of outfit or News Talk or any of these, but surely to goodness there must be other media outlets that can address this issue from the point of view of what I've outlined there. The difficulty for patients as regards communication between hospitals, and then the difficulty in business.
I can see GDPR being useful in business, but for hospital administration, I think it's going to cause a serious problem, and I think that level of privacy is not necessary in a hospital.
Well, it's not, no, because I think patients should be supported as regards the best way for communication to be, so as there's none of these restrictions that exist. So that shouldn't affect hospitals, but I believe it does affect business, Oliver, because if you have to seek the permission of a potential recipient of your business proposal that you might be sent by email, well then where do you go? How can you expand your business if you're in the internet age and you do your business by email and by the modern methods of communication that people indulge in, or that people have developed? You see where I'm coming from. I
see where you come from. I think maybe they could have done a separate GDPR for hospitals and allowed a longer time frame to implement it, because
personally I fail to understand why they even brought it in. I mean, there are restrictions already about this privacy business, but there's a limit to restricting information, the information technology industry and that, and I don't think it's a good move, and I think it should have never been introduced in the first place, because it's put a lot of difficulty and obstacles.
Thank you very much, John.
Thank you very much, Albert.